Assalamu alaikum. My name is Surmi Salim. I am working as an ICU nurse in Al Noor Hospital, Makkah, Saudi Arabia. This is my new YouTube channel for nurses, especially for those who are trying to write any exams like DHA, HAT, Prometry, MOH, or any other PhD exams like DME, DHS. See, this is my first video and this is my introduction video. If you are seeing my videos for the first time, please subscribe, share and comment what all topics you need, and don't forget to press the bell button so that you will be getting notified when I upload next video. Okay, I will not take too much time today. See, today we will be discussing about how to approach a critical thinking question. So we will go to the topic. Steps to approach critical questions. Before going to that, how to achieve success? How to achieve success? For anything, to achieve success, we need 3 important steps. What are they? First of all, we need to prepare. For everything, to achieve success, we need to prepare ourselves, our mind, and also we should prepare more things. For exams, you have to prepare your notes. You have to prepare all the topics that will coming to the exam, all the topics which would have been come to exam. Then what you will do next? You should practice. What all things you prepare, you should practice. Not one time, 2 times. You should practice more and more. Practice makes the man perfect, you know. So just practice. Next one, perform. After practicing, you can perform the exam. Okay, so these are the important steps that you can achieve success. Now we will go to now we will see the steps and critical thinking. See, here the steps I divide into 5. So there is 5 steps. We will select the answer. We will discuss one by one briefly in this slide, and we will discuss all those 5 steps with a question also, so that you will be getting familiarized more. So which is the first and foremost step in critical thinking? First of all, identify the topic. How you can identify the topic? For that, you have to read the question. See, mainly read the question for the keywords of the questions. What are the keywords of the question? For example, I will give you age. If it is mentioned pedia, if it is mentioned old age, like that, or if it is there is any time frames mentioned, or if it is a signs and symptoms. So these are the keywords. So just read the keyword again and again. Then go for the last sentence of the question, so that you can identify what the question really asking about. So by the stem of the question, you can identify really what is the topic. There are some questions, if you read the stem of the question also, you cannot identify the topic. For such type of question, we will be reading the options to get clues and cues. So this is the first and foremost step. What? Identify the topic. What is the next one? Next one is assessment versus implementation. What is assessment versus implementation? Here is the nursing process. You know, the nursing process consists of different steps. What is the first one? Assessment. The first and foremost one is the assessment. Second one is the diagnosis. Then planning, implementation, evaluation. We don't need all those things. We will just take the assessment and implementation from the nursing process. And then we will, now we finish with all the question stem, keywords in the first one. That is the identify the topic. Next is assessment and implementation. So we will take this assessment and implementation. Then we will categorize the 4 options of the question into assessment or implementation. Okay, for example, you have 4 options for a question. Among that, option A, whether it is assessment or implementation. Option 2, assessment or implementation, like that. And after that, after you write all those things, assessment or implementation, you will prioritize. For example, if your question contains all the data enough for a topic, or you identify the topic, then again you need assessment? No. That is the time you will give prioritization to the implementation. Okay, we will see in the question, so we will be understanding. So we will go to the next step. What is the next step? Physical versus psychological. What is physical versus psychological? Here comes the Maslow's hierarchy of needs. So which is the first priority for a human being? Obviously, it is the physical need. What are the physical need? Air, water, food, shelter, like that. So what is the psychological need? Care, comfort, teaching, love and belongings, like that. So now we will categorize the 4 options to physical, or psychological, whether it is a physical need or a psychological need. Then which is the priority one? We will obviously give the priority to the physical options. Here comes another one. That means if the question is asking regarding a physical, the answer should be also physical. Okay, physical need of the person. If the question is asking psychological, you should give answer by psychological option. But here we can categorize the options to physical or psychological. Okay, what is the next step? The next step is the ABCs. What is ABCs? ABCs, here this ABCs do nothing with CPR. Okay, the ABCs means airway, breathing, circulation. Okay, airway means it start from the tip of the nose to the alveoli. Anything from the tip of the nose to the alveoli related to airway. Breathing means inhalation, exhalation, oxygenation status. All those things will be falling on breathing. Then circulation. Circulation means regarding fluid or regarding heart, regarding arteries or regarding veins, capillaries. Okay, all those things comes in C. So we will categorize the options to A, B, C. If the question for airway, you will give answer priority to the airway. If you, and all these ABCs have priority than other systems. For example, musculoskeletal system, genitourinary system, gastrointestinal system. And if your question options have all ABCs, how you prioritize? Read the question. What is the question asking for? If the question asking for airway, obviously the answer should be regarding airway. Okay, so this will be also will be discussed later with one question so that you can identify. So we'll go to the next step. What is the next step? The last and the final step. This is the evaluation of the outcome. For example, by the 4 steps, okay, maybe you eliminate some of the options and you reach to the correct option. So what you will do now? Evaluate. That means the option you select will give safe and effective outcome to the patient or not. So evaluate like that. The option you selected will give anything to the situation that is mentioned in the question. That means your option is correct. So these are the steps in critical thinking. So what are the steps? Identify the topic. By reading the stem of the question, you identified the topic, or from the options you identify the topic. Next is assessment or implementation. You will criterize that options to whether it is assessment, whether it is implementation. Then you will criterize the options to physical or psychological, whether it is a physical need of the person or whether it is a psychological need of the patient. Next is the ABCs, airway, breathing and circulation. So we will criterize the options to ABC. Then after that, finally, after selecting the option, you will evaluate the option whether it give a safe and effective outcome to the patient. Okay, so we'll go to the next slide. Practice section. Here goes one question. Read the question. Take a paper with you, then read the question. A client during the transition phase of labor reports lightheadedness and a tingling sensation in her fingers. Okay, which action should the nurse take next? This is the question. So you can read the question as you learned before. Okay, whether you get the topic. So I will go to the options. First of all, ask the client to breathe into the paper bag. Remain with the client. Obtain an ABG. Start an IV. Okay, these are the options. So just read. Next, I will teach you by one step. So what are the steps for us? First of all, identify the topic. Okay. The first step is identify the topic. How we can identify the topic? So here is our question. A client during the transition phase of labor report lightheadedness and tingling sensation in her fingers. Which action should the nurse take next? So I put some color change in those words. That is the key word of the question. And the last sentence will tell you what the question really need. So here the client is in the transition phase. So what is that? You know, in labor we have 4 stages. In that stage, the first stage include what are latent, active and transition phase. In the transition phase, the cervix will be fully dilated and the lady will be going to deliver. Okay, or she has some exhaustion for the labor. So, and she is reporting lightheadedness and tingling sensation in her fingers. Think that it is normal, whether it is normal during the stage of labor or it is abnormal. Obviously, it is something abnormal. Which action, that means something the nurse is doing, should the nurse take next? Okay, then we will read the options. Ask the client to breathe into the paper bag, remain with the client, obtain an ABG, start an IV. Now you read again, think. So now you identify the topic or not? So here in labor stage, the lady is reporting lightheadedness and tingling in the fingers. So imagine in the transition phase, the lady will be having too much exhaustion and she will be having like this exhaustion. So in this exhaustion, what happens? The lady will be blowing out of too much of carbon dioxide. That means the topic is something related to ventilation. And what type of ventilation? Hypo or hyper? Hyperventilation. Okay. So we will assume the topic is something like hyperventilation. Okay. So now we will go to next step. What is the next step for our critical thinking? Assessment or implementation. Now we will see how to categorize all the options to assessment or implementation. First one, ask the client to breathe into the paper bag. It is assessment or implementation? I know you know it is implementation. We are asking the client to breathe into the paper bag. So what it does, if you breathe into the paper bag, that means inhalation and exhalation in the paper bag, so that the lady will be getting some carbon dioxide again. What she exhale, she will be inhaling also. Next one, remain with the client. Remaining with the client. The nurse is remaining with the client. Something implementation. Obtain an ABG. Obtain an ABG, that means here in ABG for hyperventilation, what we can check? We can check for carbon dioxide. So this is something giving you data. So it belongs to assessment. Start an IV. It will be implementation. So now we categorize all those things in the second step, whether it is implementation or assessment. Now is the important stage. Now we will eliminate choice. So which one you can eliminate from these? After prioritizing, it is assessment or implementation. Now which one you can eliminate? See, obtaining an ABG. I tell you before, if assessment and implementation come together, we will first give priority to assessment. So you take assessment. This is obtaining an ABG. If you need an ABG to identify that patient is having low or high carbon dioxide, for this question, no need. Because in this question, it is already mentioned the patient is reporting lightheadedness and tingling sensation in her fingers. That means patient is having low carbon dioxide already. So do we need any data? No need. So what we can do? We can eliminate the option. So next step is eliminating one option. So we eliminate option number 3. Okay, now we will go to next step. What is our next step? Physical or psychological. We will categorize the remaining options to physical or psychological. So ask the client, I will not read again the question. Okay, ask the client to breathe into the paper bag. A person who is breathing into the paper bag. When you prioritize it is into psychological or physical, it will be obviously air, food. I tell you, physical will be air, food, all those things for the patient survival. So that means asking the client to breathe into the paper bag belongs to obviously physical. Remain with the client. A nurse who will be remaining with the client for the entire labor process. That means she's giving psychological support. So that option will be belonging to psychological. So I categorize this one to psychological. Next is obtaining ABG, we remove already. Okay. Next is starting an IV. Starting an IV, obviously it is a physical. Okay. Next one. In this question, it is asking about psychological or physical. Prioritize. Obviously, it is asking about physical. Okay. So we can eliminate which option? We will be eliminating the second option. So now remaining for us is only 2 option and there is another steps for us. So we'll move to the other step. What is the fourth step for us? ABCs. So we will categorize the remaining options to A, B and C. See, the first option, ask the client to breathe into the paper bag. Is it belong to airway, breathing or circulation? I tell you, airway from tip of the nose to alveoli. Breathing will be regarding inhalation, exhalation and oxygenation. Circulation will be something to circulatory load. That means capillaries, veins, anything like that. So the first option obviously belongs to breathing, inhalation and exhalation. So we categorize the first option to B. And the last option, starting an IV. Yes, something regarding circulation. So give prioritization to circulation. So now after that we will check which is the priority. Which is the priority here, breathing or circulation? For that, what I told you, you will check the question, whether the question is asking about breathing or circulation. Obviously, the question is asking here about breathing. So, which option you can eliminate from here? The fourth one. So, we will be eliminating the fourth option. Okay. So, now we eliminate 3 options. So, that means the first option will be the correct answer. So, what is the last step for us in critical thinking? Yes, evaluation. So, ask yourself the question, or ask yourself, if you are the bedside nurse, you go into the patient and you ask the patient to do this one, or you deliver this care, whether it will give a safe and effective outcome to the patient, or whether it really gives some outcome to the situation, to the real situation. So, ask about that thing. Ask the client to breathe into the paper bag. That means the patient will be inhale and exhale from the paper bag. So that could help the patient to rebreathe the carbon dioxide. So what is that? Ask. Yes, that means it is ask the client to breathe into the paper bag is the correct option. So we finish with 4 important steps to eliminate the option, or 5 important steps to reach the correct answer. Okay. Hope you all understand my class, and actually this was my first video and first class, so there will be some mistakes. Inshallah, all those things you can mention in my comments, so that next time I will be clearing all those things. And I hope you all understand and you know how to approach the question from now. Next video we will be discussing about 2-3 questions, how to do or how to make correct options. Okay, bye bye, take care, Assalamu alaikum.